I'm Dr. Stephen Harkins. I'm a chiropractor, and I want to challenge your ideas about pain. These 5 scientific but counterintuitive concepts may seem hard to believe at first, but stick with me. Challenge number 1. Pain is not purely physical and structural like a bulging disc, or a bone out of place, or a tight muscle. Challenge number 2. Pain doesn't exist in the part of the body where you feel it. Pain signals travel through special nerves called nociceptors, where it is processed and experienced in the brain. Did you know war veterans with missing limbs sometimes experience phantom pain in their missing arm or leg? How can that be? Challenge number 3. Your brain can either amplify or quiet your pain through your experience, your thoughts, fears, stresses, and feelings. Challenge number 4. The job of pain is actually to protect you from injury, but your brain can get locked in an overprotective and hypersensitive state where it overreacts to completely normal stimuli. Challenge number 5, and here's the good news. The brain is malleable and can be reshaped like silly putty. In other words, the hypersensitive programming can be changed and reversed by regulating your thoughts, stress, and emotions. But how can chiropractic help? When you hit your finger with a hammer, what's the first thing you do? You shake it. Why? Because you're stimulating a second type of nerve called mechanoreceptors. And lucky for us, these mechanoreceptors inhibit and weaken those painful nociceptors. Before birth, your body was divided into sections called somites. Through the nerves, each section developed its own specific pattern of skin, muscle, ligaments, tendons, and even organs and glands. And pain occurs along those specific and predictable patterns. So just like shaking your hand after hitting it with a hammer, my specific chiropractic adjustments stimulate the mechanoreceptors in your spine, which intercept the nociceptive signals along those same specific, predictable patterns, thereby reducing and eliminating pain. Now here's where it gets really interesting. A third type of nerve called autonomic nerves control all the organs and glands of the body, and they can also be stimulated through the same mechanoreceptors. This is why my regular proactive wellness patients report improved breathing and digestion, better sleep and increased immunity, increased cognition and clearer thinking, and even lighter menstrual cycles. You do not have to wait for the latest health-damaging pills or surgery. My safe and effective chiropractic techniques help you address your issues from a different angle and reprogram your nervous system and start turning down the volume on your symptoms, no matter how they started or how long they've lasted. The only way to find out how much of a difference these techniques can make in your life is to get started and see what happens. And that is what I'm here to help you do. Book your appointment today, and I'll see you soon.